Thank you. Good morning, everyone. First of all, I would like to thank the Scientific Committee for providing me the opportunity of showing you this data. Despite the success of antiretroviral therapy, as we already discussed, there are some people that are fragile. Why? Because they are with a highly treatment experience, and moreover, they present drug resistance. Therefore, for these people, the treatment options are limited. Under this context, one of the drugs that are promising and has been recently approved is Lenacapavir. Why? Because it presents a multi-stage action, and moreover because he demonstrated a potent multi-drug resistance activity also in viruses with these characteristics. Moreover, as we know, Lenacapavir has been recently proposed for PrEP exposure. But we have resistance. Therefore, according to these considerations, our goal was to evaluate both genotypic and phenotypic profile in multi-drug resistance people that were enrolled in the PRESTIGIO registry. The PRESTIGIO registry is an Italian registry, of course, of people that are highly treatment experienced with multi-drug resistance documented for all the classical drugs. Among these people, we selected 9 individuals for whom we had both baseline and follow-up samples. What does mean that we had samples before the treatment of Lenacapavir and samples after at least 6 months of treatment with Lenacapavir. We did genotypic resistance test by using next generation sequencing with an homemade approach. Then we evaluated the resistance in both capsid and pole regions by using the Stanford algorithm, but also we evaluated the phenotypic profile in viremic samples. Coming to the results, in this picture you can see the characteristics of the baseline individuals at the baseline, and as you can see they had a median age of 55 years, they and were mainly male, they had mainly a subtype infection, and of course as expected they had a long history of infection and also a long history of treatment, and also they had experienced all the classes. While regarding the treatment with Lenacapavir, as you can see, most of them were treated with at least 3 drugs, and the GSS of the regimen with Lenacapavir was 1.5 with an interquartile range of 1 and 2.5. Regarding the baseline characteristics, 7 individuals started Lenacapavir as viremic individuals. 5 of them we had both BBNC and or plasma samples, while 2 started under virological suppression, and for both of them we had samples. In this picture you can see the characteristics of genotypic and phenotypic resistance profile at baseline. As you can see, for the patients for whom we had the genotypic and phenotypic resistance available information, you can see only one patient presented one accessory mutation, the 107A. But as you can see, the fold change was always very low, ranging from 0.25 to 2.5, and this means that at baseline Lenacapavir was susceptible for the individuals that we analyzed, and also the presence of 107A mutation did not impact on the phenotypic susceptibility. the treatment under Lenacapavir was with a median of 20 months. As you can see, among the 7 patients who started Lenacapavir as viremic, the 6 achieved virological suppression, and only one of them had a virological blip, while remain viremic. The other virological suppressed individuals continue to maintain their virological suppression. Regarding the individual who maintained the viremic situation, this picture represents its characteristic, genotypic and phenotypic characteristics after 27 months of treatment with Lenacapavir. As you can see, he was treated with a complex regimen, even though this regimen guarantees a genotypic susceptibility very high. Despite this, as you can see, the viremia was still high, and also after 27 months of treatment, because probably this patient, probably very surely, this patient was low adherent. And the mutations in general for the POL gene were maintained apart from the STI region. Regarding the situation for the Lenacapavir region, unfortunately we didn't have the sample at baseline, but we can suppose, according to the evidence and the previous results for the other patients, that in this case no mutations were present at baseline. But after 27 months, as you can see, he presented 2 important mutations related to the Lenacapavir resistance, with a high fold change as a consequence of the presence of these mutations. The other patient that presented the blip during its virological suppression under treatment with Lenacapavir, of course, also he had a complex regimen with the drugs administered with Lenacapavir, but he had only this blip. And during this blip, we have seen the presence of the Ki67K, but present only as minority variant. And this mutation was present only in plasma. So, to conclude, in this small population, we can see that Lenacapavir is in general associated with the maintenance of virological suppression and a good achievement of virological suppression. Only one single participant presented very high resistance mutation, with also as majority variants. The detection of the mutation Ki67K in the blip can suggest a low genetic barrier of Lenacapavir, despite the fact that probably this is also associated with a lower fitness under the presence of these mutations, and in fact we didn't see this mutation also in the PBMCs. I would like to thank all the people who participated to this study, in particular all the members of the PRESTIGIO Registry, and of course my group, Adeto Vergata, and the group of Siena, together with, we had the experiments, phenotypic experiments, and of course all of you for your attention.